like a stream, like a river, to where it flows through your body, right? You got blood, you're pumping through your legs, and blood pumping through your arms and your head and everything. And so the way I think about it too is to where that the blood is basically another way of how do you want to call this, towards it's another way, it's a stream that runs through your body. And so anything that whenever it comes to blood samples and everything, and so anything that's applied to in your body, such as if it's medication or if it's vitamins or any other source of nutrients, though. So it sure seems that way to where that yeah, well, if people were to be getting any test samples, and half the time you want to know too that how come you just can't stick your tongue on like a plate? How come they don't even ask for a tongue sample or anything like that, or just any things such as nasal spray, samples or anything? But still, I know that that they got like the cotton swabs and everything, but still that whenever it comes to testing, no, that it sure seems that way to where that that anything that when it comes to testing, no, but at the time it sure seems that way that for what's needed, just to be able to perform on a test. But on the other hand, too, that it's like that whenever you do get blood samples, though, that like everybody else are probably thinking too, is to where that is that really another way of how you can really get attention, really? Like whenever you do, because I remember back whenever I was very young, like everybody else is probably thinking too, that you've been through a lot whenever it comes to suffering with maybe a type of disability or a type of disorder or anything like that, or anything such as birth effects or anything like that, birthmarks and birth effects. And so it sure seems that way to where that a lot of things since birth that you've been that you've been battling for, and let's just say if it's a cerebral palsy or if it's ADHD or any other disorders like that, and so it's like any other disorders and conditions, health conditions, and so that's why it sure seems that way to where that if we want to cause this to where that we're all in this together, and so it sure seems that way that the only source of attention that maybe that you can get other than like through your insurance is just to kind of study just a little bit more about as to where what do you think that would make you be better whenever it comes to learning about how to stay healthy and everything. So anybody say that you might even get it from your mom, and your dad, anybody that you talk to, and just to study a little bit more about it. But I tell you one thing, though, that it sure seems that way to where that when we learn something about a lot of this stuff, and whenever it comes to a lot of serious stuff, that it sure seems that way to where that if there's like a gift of kindness and a gift of appreciation, because we all know that within the next 5 years, from now, that we're gonna maybe look back and remember is this toward it, for those children, those to be born and those to be waiting to heal, and just want to know too is toward it for all the hard work that we put into accomplishing something. And it sure seems that way to where that a lot of times that due to the pandemic and everything, that you meet people, even though if you don't know them, you might meet somebody and only talk to them and only see them maybe for a couple of hours, and then that's it. And then so it sure seems that way to where that we don't even have to be related. We don't even have to be related. So it's possible that you might meet somebody who may have had the same condition, the same situation, and so that's why that you're probably thinking too is to where that whenever it comes to fighting the virus and any other sorts of illness, sickness, and all that, that it sure seems that way to where that this is how we met right here. That whenever you do wind up getting sick with something, and so yeah, And I know that, like everybody else, about thinking too, that if you're going to be out in public talking to other strangers and talking to anybody else, and you might think too, is to where that yeah, you don't really know too much about all those other people, and so the only thing that you really have time to do really is just to say hi, and also is that you can actually see about to what exactly that they're wearing, and maybe that anything that I might say. So yeah, so it sure seems that way to where that from the bottom of our hearts is that what do you think that we can tell somebody else whenever it comes to fighting the pandemic? If you don't really have a whole lot of time to really to explain to everybody about who you are, and maybe if you're related to this person or not, or for any reason at all, that yeah, you're not related to this person. You just showed it, showing that you care, and so yeah, the care and kindness. So it sure seems that way to where that so whenever it comes to healthcare and everything, that you really you just if all you really have time to do at the moment is just to show that you care, and not really with the fact about if you really have to explain to everybody about who you are, and what you went to school for, and where you're from, and maybe about the things that you're good at and everything. So it's like, so it sure seems that way that that whenever you do go out in public, that you do meet somebody, and that you don't really have a whole lot of time to explain to them about who you are, and you're not really related, and you don't know that person very well. And so that's why it sure seems that way to where that yeah, that just knowing that whenever it comes to meeting somebody, and so that's why it sure seems that way that yeah, whenever you go get the shot, and whenever you get medical treatment or anything like that, and almost everybody else might say that yeah, talk about if it's maternity moms, or dads, or cousins, or anybody else, uncles and aunts, and but other family and friend members, and they're probably thinking too is to where that yeah, well, I'm sure that there's something that we all have learned together about what all we've been going through at like doing this virtual learning and everything. But I tell you one thing though, that one thing that I'm sure that we can all explain about it's at years to come, is just knowing about is just to where that whenever it comes to showing that we care, and the amount of support that we give to one another. And it sure seems that way to where that the best thing that you can really say is to where that yeah, if, in the thoughts, and then also is that yeah, anything during a time that maybe that you were in quarantine, and maybe during a time yeah, something that you can maybe keep at all times. And if anybody say that yeah, a Fitbit or something that you want to keep saved on your phone, during the whole time that you were in quarantine, or during the whole time that you were really struggling, that you try to explain to somebody in like a short type of manner, that you just want to show is as toward yeah, well, it's that that one thing that we could probably think about is toward it yeah, well, that we're well, and then that we're okay, and that for how everything's going, but still, I just really think too is that whenever it comes to people getting together, and you're wearing our mask, and then social distancing and everything, and half the time it's like yeah, like the side effects, and most of the time with most side effects though, that including the tiredness and nausea and other sorts of side effects related and all that, and so that's why it sure seems that way to where that yeah, yeah, while you were sleeping especially. So it sure seems that way that you just maybe have to tell somebody that while you're sleeping, that you might just be surprised that while you were sleeping, that within the 5 hours of the time that you were sleeping, that you have been cured from an infection from this disease. And so at some point that somebody might even say too that you just would like to think about what the miracle is, and that miracle would also be is to just do the study is that yeah, whenever you do I don't know about the exercises, but follow the science and talk about for following the science and doing the social distancing rules and everything, and so you're probably thinking too is toward that the one thing we could probably think about also is resting. Whenever you rest and whenever you're sleeping, know that allows it to where your body, like yeah, what I usually think about almost all the time is that when while you're sleeping, that there are things that are getting done, and that I try to think about that too, to where that while you're resting, that your body is healing, is gradually healing, and we might think too is to where that there are times to where that if you do need more than 8 hours of sleep or something like that, if you might be sleeping or napping for maybe 10 total hours, if you might be sleeping for 10 total hours, and want to know that why you seem to be so tired all the time. So it's possible that your body is recovering from something that you were doing from earlier, or trying to get caught up on rest, and so yeah, everybody probably thinking too that that's not really considered working. You're not really working while you're sleeping, but still, that if we were to do the calculations like even on a Fitbit, that whenever you do put that Fitbit on, it'll tell you that if you do while you're resting, that if you've recently gotten a shot or if you've recently taken a vitamin, or that from that meal that you had, that if you recently like yeah, so while you were sleeping, that it's allowing your body to rest also, and so another way of how do you want to cause for showing for strong immunity. But anyway, so there you have it. Talk about based about studies about the virus right there. But anyway, thanks for watching everyone, and stay healthy everyone, and thanks for watching and have a great day.